Hi everyone, welcome back to Messagify. Today we are diving into an important health topic, epilepsy. Epilepsy is a condition that affects millions of people around the world. Yet, many still have misconceptions about it. Let's explore what epilepsy is, its causes, symptoms, and how it can be managed. Epilepsy is a neurological disorder characterized by recurrent seizures caused by abnormal electrical activity in the brain. A seizure is a temporary disturbance in the brain's electrical function, which can affect how a person feels, thinks, and behaves. We have types of seizures. One is focal seizure, and another one is generalized seizure. So focal seizure is it starts in one specific area of the brain and can cause localized symptoms such as twitching or unusual sensation. And with the generalized seizure, it affects both sides of the brain from the onset and also results in loss of consciousness, convulsion, or muscle stiffness. What causes epilepsy? So, what causes epilepsy? The causes of epilepsy can vary widely, and they are genetics. Some types of epilepsy may run in families, and also head injuries, trauma to the brain can also lead to epilepsy. Another causes is infections. Conditions like meningitis, encephalitis, brain abscess can also trigger seizures. Brain conditions like tumors, strokes, or developmental disorders can also be factors of epilepsy. And also prenatal injury. Brain damage can also occur during pregnancy or birth. What are the symptoms of epilepsy? Symptoms can differ based on the type of seizure, but may include one, uncontrolled jerking movement, loss of awareness or consciousness, confusion or unusual sensation, staring spells, temporary paralysis or weakness after seizure. What are the diagnoses of epilepsy? Diagnosing epilepsy usually involves several steps. One is medical history to that contain a detailed history of symptoms and a family history, and also neurological exam to assess the brain functions and behavior, and also EEG, that's electroencephalogram, to record electrical activity in the brain to identify seizure pattern. Also, imaging test. We will use MRI or CT scan to look for any structural issues in the brain. How can we treat and manage epilepsy? Since there is no cure for epilepsy, it can often be managed effectively through medications, that is, anti-epileptic drugs, and also lifestyle changes. You maintaining a regular sleep schedule, avoiding triggers, and managing stress can be a beneficial for you. And also surgery. In some cases, surgery may be an option if seizures are not controlled by medication. Lastly, there's vagus nerve stimulation. A device is implanted under the skin that can help reduce seizures. Living with epilepsy can be challenging, but many people live full lives. Here are some tips for managing the condition. Understanding epilepsy helps in managing it better and reducing stigma. Also, connecting with support groups can provide emotional support and practical advice. And also, having a plan in place for seizures can help individuals and their families feel more secure. We have some myths and misconceptions about epilepsy. Yeah, there are many myths about epilepsy that contribute to misunderstandings. Let's debunk a few. There's a myth that people with epilepsy can't live a normal life, and that's not true. The fact is, many people with epilepsy, when they manage the condition well, they'll be living what? A fulfilling lives. Also, there is a myth that you can swallow your tongue during a seizure. This is not possible. However, it is important to keep the person safe during seizure. Another myth is that epilepsy is contagious. Epilepsy is not contagious. It is a medical condition. Now, we have understood epilepsy well. Epilepsy is a complex condition that affects many individuals and their families. And understanding it can help reduce stigma and improve support for those affected. If you or someone you know is dealing with epilepsy, don't hesitate to seek help and connect with others. If you found this video informative, please like, subscribe, and share your thoughts in the comments below. Thank you for watching and take care. Brain conditions like tumors, strokes, stroke as strokes.